Ever wondered how crucial a role your lungs play in your life and what happens when they get diseased? These twin powerhouses tucked away in your chest, working tirelessly, are your lungs. They play a paramount role in keeping us alive and kicking by supplying oxygen to every cell in our body and expelling carbon dioxide, a waste product of the body's metabolism. The health of your lungs is crucial. Just like an engine can't run without clean fuel, your body can't function optimally without a steady supply of oxygen. However, these vital organs are susceptible to various diseases that can hamper their function. Lung diseases, a broad term for disorders that affect the lungs, can range from infections like pneumonia to chronic conditions like asthma, and even to life-threatening diseases like lung cancer. Recognizing the importance of lung health is the first step towards prevention and treatment. In the next segment, delve deeper into the different types of lung diseases. Lung diseases are not all created equal. There's a wide range out there. Indeed, lung diseases come in many shapes and forms, each with its unique set of symptoms, causes, and treatments. First up is asthma, a chronic condition characterized by inflammation and narrowing of the airways. This inflammation leads to a range of symptoms, including wheezing, shortness of breath, chest tightness, and coughing. What makes asthma unique is that it's often triggered by specific allergens or irritants, such as pollen, dust mites, or even exercise. Next, we have chronic obstructive pulmonary disease, or COPD for short. This term actually refers to a group of lung diseases, including chronic bronchitis and emphysema. These conditions are marked by difficulty breathing due to long-term damage to the lungs, often from smoking. Then there's lung cancer, one of the most common and deadly types of cancer worldwide. Lung cancer usually starts in the cells lining the air passages and can take several forms, with non-small cell lung cancer and small cell lung cancer being the most common. Moving on, we have pneumonia, an infection that inflames the air sacs in one or both lungs. Pneumonia can be caused by a variety of organisms, including bacteria, viruses, and fungi, and can range in seriousness from mild to life-threatening. Last but certainly not least is tuberculosis, a contagious disease caused by a bacterium called Mycobacterium tuberculosis. This disease primarily affects the lungs, but it can also spread and cause disease in other parts of the body. Each of these lung diseases presents its unique challenges and requires different approaches to treatment. But what they all have in common is the serious impact they can have on a person's quality of life and overall health. Now that you have an understanding of the types of lung diseases, let's examine what causes them. What triggers these diseases? Is it something in the air or our lifestyle, perhaps? To get to the root of this, let's delve into the primary causes of lung diseases. One of the most well-known culprits is smoking. Yes, it's not just a warning on the pack. Smoking indeed leads to a variety of lung conditions, including chronic obstructive pulmonary disease, or COPD, and lung cancer. But it's not just smokers who are at risk. Exposure to certain gases or fumes in the workplace can also play a significant role. Industries like mining, construction, and manufacturing often expose workers to harmful substances such as asbestos, silica, and coal dust, which can lead to diseases like pneumoconiosis or mesothelioma. Next, we have infections. Bacteria, viruses, and fungi can cause infections like pneumonia, tuberculosis, and bronchitis, leading to inflammation and damage to the lungs. Lastly, let's not forget genetics. Sometimes, the cause of lung disease is written in our DNA. Genetic factors can make some people more prone to certain conditions, like cystic fibrosis or alpha-1 antitrypsin deficiency, which can both lead to lung disease. So, it's clear that both our environment and our lifestyle choices can influence our lung health. But it's also important to remember that our genetic makeup can play a part too. With the causes known, we should examine the risk factors that make us more susceptible. Are some of us more prone to lung diseases than others? We're about to dive into this question and explore various risk factors that could make an individual more susceptible to these conditions. Firstly, Age is a significant factor. As we grow older, our lungs naturally become less flexible and lose their ability to inhale and exhale fully. This can make us more prone to respiratory diseases. Smoking is another major risk factor. The chemicals in tobacco smoke can cause significant damage to the lungs, leading to diseases such as chronic obstructive pulmonary disease, or COPD, and lung cancer. And it's not just smokers who are at risk. Exposure to secondhand smoke can also cause severe damage to the lungs, making it a significant risk factor for lung disease. A personal or family history of lung disease can also predispose one to these conditions. If your family has a history of lung disease, you may be genetically predisposed to developing similar conditions. Lastly, exposure to certain pollutants such as asbestos, radon, and certain types of dust and fumes can significantly increase your risk of developing lung disease. So, yes, some of us are indeed more prone to lung diseases than others due to a combination of genetic, environmental, and lifestyle factors. Knowing these risk factors, it's essential to understand how we can prevent lung diseases. And that's what we'll explore in the next scene. Stay tuned. Can we shield ourselves from these diseases? Absolutely. Now, let's dive into some preventive measures and precautions that can help safeguard our lungs from diseases. First, let's start with the most obvious one: smoking. If you're a smoker, quitting is the best thing you can do for your lungs. Smoking damages the airways and small air sacs in your lungs, making you more vulnerable to lung diseases. So if you smoke, quit. And if you don't smoke, don't start. But what about secondhand smoke? Even if you're not a smoker, exposure to secondhand smoke can also harm your lungs. So, make your home and car smoke-free zones. If you have friends or family members who smoke, encourage them to quit or at least not to smoke around you. Next, let's talk about vaccines. Getting vaccinated against respiratory infections like the flu and pneumonia can protect your lungs from serious damage. These infections can be particularly harmful to people with lung diseases. So it's crucial to keep your vaccines up to date. Keeping good hygiene is another way to protect your lungs. Regular hand washing can prevent the spread of viruses and bacteria that can cause respiratory infections. And in times when respiratory diseases are prevalent, wearing a mask can offer an additional layer of protection. Avoid exposure to outdoor air pollution as much as possible. On days when the air quality is poor, try to stay indoors. If you have to go out, consider wearing a mask to filter out harmful particles. Finally, maintain a healthy lifestyle. Regular exercise can help keep your lungs strong and resilient. A balanced diet rich in fruits and vegetables can also support your immune system and help your body fight off infections. Prevention is better than cure, but if you're at risk, regular checkups can go a long way. Regular lung screenings can catch diseases early when they're most treatable. So if you have a history of lung disease in your family, or if you've been a smoker, make sure to get your lungs checked regularly. To recap, lung diseases are a crucial health issue that we need to be aware of. These afflictions can drastically affect our quality of life, and in severe cases, they can even be life-threatening. We've explored the various types of lung diseases, from the common cold to the more serious conditions such as chronic obstructive pulmonary disease or COPD and lung cancer. Each of these diseases presents its own unique set of challenges, symptoms, and treatment options, and they all underline the importance of maintaining our lung health. We've also delved into the causes of these diseases. While some, like the common cold, are caused by viruses, others like COPD and lung cancer can be traced back to environmental factors such as tobacco smoke and air pollution, or even our own genetic makeup. The risk factors for lung diseases are many and varied. Smoking, exposure to secondhand smoke, and exposure to certain chemicals or substances at work can all increase our risk. So too can a family history of lung diseases. But remember, having a risk factor does not necessarily mean you will develop a disease. It merely increases the likelihood. Prevention is always better than cure. We've discussed the importance of taking precautions to protect our lungs. These include quitting smoking, avoiding secondhand smoke, and being mindful of the air quality around us. Regular exercise can also promote lung health, as can getting regular checkups to monitor our lung function. Knowledge is power, and understanding lung diseases and how to prevent them can go a long way towards promoting our overall health and well-being. It's crucial to remember that our lungs, like every other part of our body, require care and attention. Remember, your lungs have a vital role to play in your life. Keep them healthy, and they'll return the favor.